Are you struggling with low back pain from a disc bulge, nerve irritation, a muscle strain? I'm Doc John from Mobility Doc, and I want to give you some actionable advice on what you can do right now to change the pain you're in and then to make sure it doesn't get back. For a comprehensive take on what low back pain is and debunking the myths and misconceptions, I highly suggest you watch our video about low back pain. In this video, I want to focus on what you can do and that will keep you from having this reoccurring issue. So first, I want to get into mobility or flexibility. I want to get into self-myofascial release or self-massage. The reason is if you're in back pain right now and you begin with just strengthening your low back, you are putting the cart before the horse, in the sense that while, yeah, it's true, you need to get your back, your hips, your core stronger, the first thing you need to do is not be in pain, because if you're in pain and trying to be strong, your pain creates this neurological reflex that shuts down your ability to control your core, to use your muscles effectively. So let's first get into the things you can do to get out of pain right now. And remember, with anything medical, make sure you're consulting with a medical professional that you trust, that you know and have a relationship with, who can make sure to identify properly what your root cause of your back pain is, to make sure that this is the right step for you. All right, so moving along, I want to first talk about percussion. This is a Hyperice Hypervolt. This is what we use in our clinic at Mobility Doc. It is not the only form of percussion you can use, but percussion, generally speaking, vibration is great because it increases blood flow and circulation, and it decreases the tension and stiffness in the muscle, which can help to decrease the spasm, decrease the pain, right? So it's a very easy thing to do too, which is why I'm covering it right now. No matter which percussion instrument you have, it should be enough to at least get you an appreciable decrease in pain, right? Now, the Hyperice Hypervolts are our favorite, but again, that doesn't mean that you shouldn't use what you have or that you have to absolutely use this one. So I'm going to turn this on and simply show you that even while I'm sitting, my voice is getting a little funny, but even while I'm sitting, I can be comfortable and supported and work on decreasing this pain that I have. I'm going to stand now and just kind of talk you through this. So what you want to make sure that you're doing with a percussion instrument like this is you want to not just go right to where the pain is. You want to get above your glutes. You want to get around your SI joints. You don't have to worry about, like, can I go on my spine? Can I go on the SI joint? Is it going to hurt me? Because it's not. As long as you're not putting a monstrous amount of pressure with your hands into the percussion instrument, then there's really nothing to be concerned about. If it hurts, if it's like feeling bruised, just back off a little bit with your pressure. If you do this too much, the worst that you would see would be some bruising, some touch sensitivity. That's okay. That's why you'll do this as much as you can. You could do this multiple times in a day, but maybe you find that you need to back off a little bit depending on what you're feeling. So again, if you can't do the standing, you can easily do the sitting. You're going to want to spend some time, like 30 seconds or so, in the areas that feel the tightest, that feel like you need it the most. And then you want to continue to move around to canvas as wide of an area as possible, so that way you make sure that you don't miss anything important. Again, cover your back, cover your glutes, cover your hips. Percussion therapy is excellent because no matter how much pain you're in, it tends to be that most people can at least tolerate this to begin to create a change, and you'll know immediately after that you have done something, because you'll feel warmth, you'll feel tingling from the increased blood flow and circulation. If you have some tips that you want to share that you found helpful with the percussion gun, or just to give some words of encouragement and advice, make sure you comment below and let others know. This a lot of us have seen before. Maybe some of us haven't yet though, which is why I want to go over it. This is the Acupressure Cane from Trigger Point. This is something that in our clinic we sell as a very easy, effective way for someone to self-treat their back pain. And again, we're still talking about what are things that you can do while you're in pain that don't involve a whole lot of movement, so you don't risk going into spasm again. Let me slide this thing kind of out of the way. This has kind of a point that's soft at the edge here, but there's also these two orange circular spheres that are great for also digging into spots that need it. But the great thing about having a cane like this is that you can hook around, put your hands on those two spheres at the end, and you can pull with your hands to apply pressure into your back. Now, it's more of like, I suppose I'm doing like a chest press. I'm just subtly pushing away, and I'm using some tricep, the rest of my arms and my chest. If I have a seat while I'm doing this, what you can see is I find a spot, and again, I'm focusing on my left just so it's easy for the camera, but you find a spot that feels tight, you hook into it, and then you pull or push away. I can apply a pretty good amount of pressure. Again, hold for like 30 seconds. You can go a little bit more, don't go much less than 20 seconds before you move into the next spot to make sure you've fully satisfied achieving the threshold, the minimum threshold you need for a change, which is around that 30-second mark. And like here for me in particular is a tighter, more sensitive spot. What you'll notice is it'll feel like you're going over this like lumpy bump, right? Like this, like you could tell it's not bone, but it's almost questionable. Like, is it muscle? Because should it be so hard? But obviously it's muscle, right? I'm on my paraspinals right now. Again, you're holding about 30 seconds to a minute. If you needed to, you could even use the ball area to push in, but I like to have a mechanical advantage by going like this, by pushing out with my hands as I'm pulling into my back. Again, you can also pull into the glute, into the side of your hip here, getting just above the SI joint. I've found this to be extremely helpful, not only for my patients, but also for myself. So after you've exhausted, maybe with the massage gun, you've gone about 2 minutes to 3 minutes, maybe a little bit more. Maybe you spend another couple minutes with this. Depending on how you're feeling and your pain, a foam roller really is one of the best things that you can have for your back. And maybe first you're spending more time with these like static posture ways of decreasing the pain, but what you can quickly move into is foam rolling through the back. So one of the ways that's most common is people kind of just move back and forth. We'll link here a video on how you should foam roll and what the guidelines are on how to go about this. But just to cover it generally, you want to scan an area to see what's painful, and then you want to hold on those spots for about 30 seconds, just like I said with everything else so far. The reason why I'm on my middle back is because if I go with the foam roller into my low back, I start to risk creating more of an increased arch in my spine, and that's not actually what I want right now. What you're gonna do is you're simply going to roll above the low back and hold on spots above the low back to decrease the tension through your middle back to help your low back. It's kind of like a way of backdooring into this. And what you can do for a little next level, if you're feeling ready for it, is you can interlock your fingers and just arch back and up. And now I'm only moving through my thoracic spine. I'm not arching in my low back or my lumbar spine. So doing this action while keeping my low back nice and static or stationary, moving through my shoulders, my chest, and my middle back, my thoracic spine, I can continue to improve the mobility or the pliability of my spine. So you would maybe go up and down your spine about 3 times, trying to hit as much of your middle thoracics and low thoracics as possible. You don't necessarily have to go all the way up to the base of your neck. You can focus just below your shoulder blades and just above the low back. Also, you can very easily foam roll into your glutes if you felt like massage gun or the cane isn't enough. What I would recommend is have one foot on the ground, hook the other one over, and then roll carefully along the foam roller. And again, holding on spots about 30 seconds, trying to find what's most effective. I'm kind of surfing the edge there. There we go. So again, move your hips around, cover the entire surface area. Make sure you don't miss anything. You can drop down on your elbow here. Right now, I'm just above my SI joint. Again, you don't have to be concerned about rolling on the SI joint. That's okay. Find a spot, foam roll through glutes as well as your middle back. Use the massage gun through your glutes and your low back, and you can also get middle back. The stick, you can get through as much of that as you want. I would do that every single day, as many times as possible, eventually working up to using the foam roller more. You might find at first, depending on how acute your low back pain is, you can't. If you use this combination and spend 10 minutes every day exploring with the foam roller, the stick, the massage gun, you will get yourself into a space where you will no longer have pain. You just have to be consistent and persistent. If you have any questions or comments, things you want to share about your personal journey and success or struggles around your low back pain, please comment below. Like, subscribe, share us with your friends, help us to help more people. I am Doc John from Mobility Doc. Stay tuned for more information on how you can move well and live well.